is a detailed explanation of the physiology of the circulatory system, including every key functional aspect of its components. Physiology of the circulatory system. 1. Introduction. The circulatory system, also called the cardiovascular system, is a closed system consisting of the heart, blood, and blood vessels. Its primary role is to deliver oxygen and nutrients to cells, remove carbon dioxide and metabolic waste, maintain homeostasis, body temperature, pH, fluid balance, aid in immune defense and hormone transport. 2. Structure and functions of major components. A. The heart, cardiac physiology. The heart is a muscular organ that works as a double pump with right side pumping deoxygenated blood to the lungs, pulmonary circulation, left side pumping oxygenated blood to the body, systemic circulation. Cardiac chambers, right atrium receives deoxygenated blood from the body. Right ventricle pumps it to the lungs via the pulmonary artery. Left atrium receives oxygenated blood from the lungs. Left ventricle pumps it to the body via the aorta. Valves of the heart, atrioventricular valves, tricuspid, right, mitral bicuspid, left. Semilunar valves, pulmonary, right, aortic, left. Function, prevent backflow of blood. Cardiac cycle. The cardiac cycle consists of atrial systole, atria contract, pushing blood into ventricles. Ventricular systole, ventricles contract, ejecting blood to lungs and body. Diastole, relaxation phase, heart chambers fill with blood. Heart sounds. S1, closure of AV valves. S2 dub, closure of semilunar valves. B, electrical conduction system. The heart beats independently due to the intrinsic conduction system. 1. Sinoatrial SA node, pacemaker, initiates impulses. 2. Atrioventricular AV node, delays impulse to allow atrial emptying. 3. Bundle of His, conducts impulses to ventricles. 4. Right and left bundle branches. 5. Purkinje fibers stimulate ventricular muscle contraction. Electrocardiogram, ECG, P wave, atrial depolarization. QRS complex, ventricular depolarization. T wave, ventricular repolarization. C. Blood vessels physiology. 1. Arteries carry blood away from the heart, have thick walls, smooth muscle and elastic fibers. High pressure system. 2. Arterioles control blood flow to capillaries, major site of vascular resistance. 3. Capillaries, single endothelial cell thick, site of gas, nutrient, and waste exchange. Blood moves slowly for efficient diffusion. 4. Venules and veins carry blood back to the heart, thin walls with valves to prevent backflow. Act as blood reservoirs, store 60% of blood volume. 3. Types of circulation. A. Systemic circulation, from left ventricle, aorta, body tissues, right atrium, supplies oxygen and nutrients, removes wastes and CO2. B. Pulmonary circulation, from right ventricle, lungs, left atrium, oxygenates blood and removes CO2. C. Coronary circulation, supplies blood to heart muscle itself via coronary arteries. D. Portal circulation, blood from gastrointestinal tract, liver via hepatic portal vein for detoxification and nutrient processing. 4. Blood pressure and flow. A. Blood pressure, BP, force exerted by blood against vessel walls, measured as systolic during heart contraction, diastolic during relaxation. Normal 120/80 mmHg. B. Regulation of BP, short-term mechanisms, baroreceptors in aorta, carotid sinus detect changes. Autonomic nervous system adjusts heart rate and vessel diameter. Long-term mechanisms, renin-angiotensin-aldosterone system, antidiuretic hormone AD8, atrial natriuretic peptide ANP. 5. Capillary exchange. Exchange between blood and tissues occurs via diffusion, oxygen, CO2, glucose, etc. Filtration, driven by hydrostatic pressure. Osmosis, driven by osmotic pressure, especially albumin. Bulk flow, balances fluid movement into and out of capillaries. 6. Cardiac output and factors affecting it. Cardiac output, CO, equals stroke volume, SV, heart rate. Stroke volume, amount of blood ejected per beat. Influenced by preload, venous return. Afterload, resistance. Contractility, force of contraction. Normal CO, 5 to 6 Lel per min at rest. #7. Hormonal and neural regulation. Autonomic nervous system, sympathetic increases heart rate and force via norepinephrine. Parasympathetic slows heart rate via vagus nerve and acetylcholine. Hormones, epinephrine, norepinephrine increase HR and BP. Aldosterone increases sodium water retention, BP. ADH, vasopressin, promotes water reabsorption. AMP, lower BP by promoting sodium water excretion. #8, blood and its role. Components of blood, plasma, 55%, water, proteins, electrolytes, hormones. Formed elements, 45%. RBCs, transport oxygen via hemoglobin. WBCs, immune defense. Platelets, clotting. Functions of blood, gas transport, O2, CO2s, nutrient and waste transport. Immune response. Temperature regulation, acid-base balance. 9. Specialized circulatory adaptations. Fetal circulation. Includes foramen ovale and ductus arteriosus to bypass lungs. Thermoregulation. Blood vessels constrict, dilate to conserve or release heat. Exercise. Increases CO, shifts blood to muscles, enhances oxygen delivery. 10. Clinical correlation examples. Shock. Inadequate tissue perfusion due to low CO or low BP. Hypertension. Chronic high BP increases risk of heart failure and stroke. Heart failure. Inability of heart to maintain adequate CO. Arrhythmias. Abnormal electrical conduction disrupts pumping efficiency. 11. Conclusion. The circulatory system functions as a complex, well-regulated system essential for sustaining life. Its physiological processes, from the rhythmic beating of the heart to the minute exchanges in capillaries, are finely tuned to meet the demands of different tissues and maintain homeostasis in varying conditions. Here are 10 applications and implications of circulatory system physiology in nursing. No explanation as requested. 1. Monitoring vital signs, e.g. blood pressure, heart rate. 2. Administering cardiovascular medications accurately. 3. Recognizing signs of shock and circulatory failure. 4. Performing accurate cardiac assessments, auscultation, ECG interpretation. 5. Managing fluid and electrolyte balance. 6. Providing care for patients with heart diseases, e.g. heart failure, MI. 7. Educating patients on lifestyle changes for cardiovascular health. 8. Monitoring for complications post-surgery, e.g. hemorrhage, DVT. 9. Using compression devices and positioning to promote venous return. 10. Responding promptly to cardiac arrest and performing CPR. Thank you. Have a nice day.